This is a particularly interesting horse because of the chronicity of the lesion. This is an active cutting quarter horse that suffered an acute event, and upon examination we were able to discern that he had an acute rupture of his fibers in his suspensory ligament in this area here. But the interesting thing about this horse is the tremendous amount of fluid in the joint, plus this 10 millimeter thick dense tissue in the paraligamentous area, and also this on the axial border, suggesting that this is a very chronic situation. The fibrosis was very dense, firm. The horse was positive to fetlock flexion, and we decided to see if we could eliminate the scar tissue. The scar tissue was 7 to 10 millimeters thick in the subcutaneous area, and then it takes off-axis scans to be able to determine how much scar tissue is within the ligament. And if we look at this slide here on the right, we can see the suspensory branch in this area utilizing the off-axis technique, where fibers that are parallel and fluid will show in off-axis as being black or certainly dark. Anything that's perpendicular to that off-axis beam then is going to show bright, like we see these strands of fibrous tissue within that ligamentous branch. This should be a black area right here. We can see the axial border scar tissue at this level. We see scar tissue that's penetrating into the substance of the ligament, and then plus this burden of scar tissue up to the subcutaneous level at that time. So when he came to us, he was a horse that looked like he was going to have a very severe problem with his continuing on his career. We know that we could heal that up with time, but if we have that burden of scar tissue, this guy's going to be prone to injury. This is the left slide is 321.12. This is 1024.12, and we can see this is the way we left his ligament. This part of the ligament right here is corresponding to this ligament right here. And very noticeably, the ligament is up against the subcutaneous margin of the skin. We do have some residual fluid in the joint. Then we have just a bit of scar tissue here on the axial border. The off-axis scans allow us to be very accurate about what's going on within that ligament. So the suspensory branch is this whole area infiltrated with scar tissue on 321. This was 321, just outlining some of the scar tissue that we can see around this, and we have more echolucent tissue here, but certainly not a large number of normal fibers. And then on 1024, on a recheck, this is the suspensory branch here. Notice that most of it is black except for a few fingers of scar tissue that remained in that ligament. So all of these fibers then that we are examining are indeed parallel fibers because they're black on the off-axis scan. Using a 3D reconstruction of this, this is the ligament, a block of pictures that we took with the 3D Logic View, or the Logic E system, and we notice that this is the area here where we have the break in the fiber pattern. That same area then, notice that it's smaller on this 3D block on 1012. This is all the paraligamentous scar tissue up here. We don't have that anymore, and we don't have it as a large ligament. But in this area here, we do indeed now have parallel fibers running through that area of healing. So this was a very significant case, because not only did we repair the injury, we also removed the scar tissue from within and around the ligament, and this horse has gone back and shown successfully for a couple of years and is winning. He has had no recurrence of his injury. I'd like to stress a couple of things on this particular case. This is actually 6 weeks after treatment of this patient, And we can see the cross-sectional view here. And what I'd like to point out are these dark areas that are surrounding the tendon fiber fascicles. This is increased fluid within the extracellular matrix. We don't have any fiber ruptures in this horse. We have one area of fibrosis that persisted right here. But the thing I want to impress upon people is that once we balance and once we restore this extracellular matrix, which is one of the abilities of the high-intensity laser, is that we decrease the amount of fluid within that tendon. And notice that we have a decrease in size from 1.67 square centimeters to 1.08 within 6 weeks. Now, we can also see that we have a different fiber pattern. We don't have as much of the equilucent area surrounding fiber fascicles, but we do have a little bit left. But that has, this tendon has decreased in size in all dimensions. You notice how it's hanging over the deep flexor tendon and the inferior check ligament here, and then at the same level then it has reduced in size to near normal. We'd like to see it a little bit below 1.0 square centimeters, but we can see that this thing has shrunk in all dimensions. Now this would be the tendon then that would correspond to an adaptive tendon or a green tendon that people talk about. Young horses that go to work and they get a big tendon. They don't necessarily have to be painful, but the increase in fluid content within that extracellular matrix can get to the point where it will cause pain from the hydrostatic pressure. So we can have a horse then that works. We look at him, he's got a tendon that looks a little puffy. We do an ultrasound exam on him and we see the spaces around the fiber fascicles. We see a slight enlargement of the tendon. It may be tender, and the animal will have an unstable tendon. In other words, he's unable to train. And on treatment then with reestablishment of that extracellular matrix, they're able to go on. I just want to point out also, we did have the scar tissue along that border of that tendon. That has decreased somewhat, but the interesting thing is that we've lost that water within the extracellular matrix. Horses like this don't require the whole treatment with regenerative laser therapy because we don't have to grow new fibers. So horses that just have the extracellular matrix breakdown with an increase in fluid, increase in tendon size, may or may not be painful, can benefit from a short series of treatment. And they don't have to go through the rehabilitation or the maturation of fibers that we produce. So these animals are able to go back to work earlier than most. This is a horse that had a so-called adaptive tendon or an unstable tendon as a 2-year-old. He was unable to race. He had several bouts of tendon enlargement, a little bit of pain on palpation, but no fiber tearing or what have you, and he went into training and ran several races and then eventually won at Churchill Downs at 1 1/8 miles. So his tendon did not have any recurrence of the extracellular matrix problem. Once again, he had fibers that were there. There was no fiber tearing, but he did have enlarged tendons with fluid around the fiber fascicles, as shown on the previous horse, and was able to come back and race very successfully. He has had no recurrence that I know of at this time. This horse is a very interesting case. He was very lame at the walk. No sound on this, right? At any rate, he was very sore at the walk. He was 4 out of 5 on medication at the walk. The horse was going to be destroyed, and we decided, this was actually the day the laser came, we decided to try and see if we could make this horse feel better and help him out. We could not use ultrasound to look at his structures within his hoof because the there was calcification in the tissues that blocked the sound beam. So we treated him without a definitive diagnosis. We did so well clinically within a very short period of time, demonstrating the dramatic analgesic effect of the treatment, that we were very concerned about what he had, and that forced us to do the standing MRI. And we can see in this first view on this T1 weighted image that we can follow the deep flexor down to this level right here. It should extend down over the palmar aspect of the navicular bone and insert right here on the third phalanx. This is not magic angle artifact on an MRI. It's an actual loss of tendon material. This is a stir image, a gradient echo stir image. We can see the navicular bone, the collateral ligament of the navicular bone, the impar ligament, and there's a lack of continuity of the deep flexor tendon extending down to the third phalanx. And we can confirm that in cross-section. This transverse section, we can see a little bit of tendon in this one lobe, a little smattering of low signal material here on this T1 weighted image, telling us that the deep flexor tendon is pretty well obliterated in that area. This is a T1 weighted gradient echo stir, and we can see some remnants of tissue in that particular area. So we were extremely concerned that this animal might rupture his tendon because of the extreme nature of it. Now these lesions are lesions usually of ischemia. A big project done in Germany determined that they're most likely degenerative changes. Dr. Roy Poole, now at Texas A&M, has spoken about these injuries at the level of the navicular bone, and says that he sees lesions of ischemia on the histopathology. So when MRI was first started on horses, we would find incidental small white spots within the deep flexor tendon on horses that were not lame. Or in the normal leg, we would see these small spots. We followed some of them for 18 months, looking at them with MRI, and some of those would stay stable. Other ones would progress to larger involvement, which would eventually lead to clinical signs. So in light of what we saw here, the tendon treatment that we prescribed for him was between the bulbs of the heel. We are looking at a 5 centimeter depth of penetration of the sound beam because of its wavelength and its pulsed characteristic that allows it to go 5 centimeters deep to the skin. And we were treating this area here in the palmar pastern and down to this area here. He was treated through the frog here to look after whatever was here at the palmar aspect of the navicular bone and the insertion of the deep flexor tendon. And this then was going to give us access to the damaged tissue. With time then, we took a second MRI after several months to see what was going on, and we could see a faint outline of a tendon now extending all the way down to the insertion site on P3, which got us very excited because it was evidence that we were actually replacing the necrotic tissue. We have established a blood supply. We've been able to regenerate the ligament or the tendon fibers in the plane that they were meant to be in. We can look, this is one of the areas that was there before, and we see that this area here now has an increased signal corresponding to the long axis image, telling us that, hey, we are regenerating tissue. Without a blood supply, this wouldn't have happened. So the initial treatment then allowed the blood supply to come into this area to bring cells and what have you in here to take care of the problem. So this is the horse after treatment. Remember that he was 4 out of 5 lame before treatment. And this is the images that were taken about a year later, and we can see the growth of the tendon from low signal all the way down to the insertion site. We can see the cross section then has filled in with dense tissue of a normal signal level. So for all intents and purposes, he regrew a segment of tendon from this point down to that within, and part of that which is within the hoof capsule, telling us that if we can penetrate with an ultrasound beam and look at tissue and it's within 5 centimeters, we can treat that tissue. This is what he looked like before. We saw that the tendon stopped at this level here, the majority of it, and then didn't have much down at the insertion site. Looking again at the cross-section, then of what we started with. We thought this was an extremely successful venture on this horse. The horse is continuing to have activity in his life. He was scheduled to be destroyed because of the painful episode, and he demonstrated to us the ability of this laser process to provide the energy at those depths to cause stimulation and regeneration of a really a dead-end injury in a horse. This is a extremely severe necrotic episode in that deep flexor tendon. I'd like to make some comments on tendon injuries. Now, this is a 3-year-old that had a typical central core episode. In the tendon, we can see the tendon is enlarged, 1.29 square centimeters. It should, in a racing thoroughbred, be in the area of 0.8 or 0.9. And we can see that we have outlined the tissue that's remaining on this, forgetting about the hole. And that will give us a better estimate of how much rehabilitation we have to do. So this is the typical appearance of something like this, the central core. We found early in the game, back in the 80s, that we had to eliminate the central core. The central core was the area where scar tissue would form, and we would then have different elastic properties of the surrounding ligament fibers and the scar tissue within the core of the tendon. And there was a high incidence of recurrence. So our main aim then is to get to these tendons as quickly as we can, because it has been shown that if we do acute lesions with the laser treatment and clean up the area and remove all of the components of the damaged tendon and then regenerate the tendon, it's much easier to do. We get a better repair, and it doesn't take nearly as long. Now, central core injuries are the group that have the best prognosis in horses. They look the worst, but diffuse tendon injuries and surface tendon injuries have a poorer prognosis than the central cores. So when we find this central core, then we figure out a way to get rid of it. The old timers would split the tendon, what have you. Now with the cold compressive therapy, we can eliminate those, or we can use laser therapy. So this is the animal at, the date on this one is 4/11, and now we're looking at it at 6/07. So it's not too long, and we've collapsed this central core. We now have a tendon that's smaller than what it was. It's not much, it's not down to normal yet, but it's been a very short period of time. So what we've done then is we've removed blood, lymph, what have you, enzymes, free radicals, and what have you from that area to give us a nice bed to regrow fibers. And it shows fairly nicely early in the game. You'll notice that there are some areas of fluid around the fibers in the area of the extracellular matrix as well. This is a long axis view then of that core, where we see that we have fibers that are beginning to remodel in that site, and eventually we'll replace the core with fibers. This is a logic view, which allows us to look at the entire tendon in one scoop and shrink to fit the screen so we can follow this tendon down. And this is the area of the injury right here. Fairly long, fairly extensive on 4/11, and then this is what it looks like after the initial treatment to collapse the core down. And we're very confident in tendons like this that we will be able to rehabilitate them and get them back to the racetrack once we grow fibers in the central core. One of the problems with racehorses and in my practice is once they go back to the racetrack, then sometimes we lose them to imaging follow-up, so we just have to look at the race records to see if horses are performing. But this shows a very nice graphic presentation of what the problem is. If we had left that there and it healed by scar tissue, there would have been a central core of scar tissue within that part of the tendon. And then at the interface between the fibers and that central core of scar tissue, then we would have a difference in elastic properties, which would lead to a high incidence of recurrent injury. Fibers that we regenerate take about 6 months or so to become changed from a type 3 to a type 1 collagen. We do have to respect that. The horses are rehabbed, of course, in slow exercise, mild exercise through that time of fibrogenesis. It has been shown that exercise does help align fibers in wounds and what have you. So we do have to respect the calendar on these horses and make sure that they get some long, slow exercise initially and then pick up the pace at about 6 or 7 months. And we're probably looking at most of these horses being able to perform within 10 to 12 months. That's not much different than the historical treatment time to get them back. But right now, this is our best guess is it's probably going to be close to the 10th or 11th month before they're able to race.